Imagine yourself an independent and self-sufficient human. You've planned your life, and you've experienced both successes and failures. And you've gone about your life fully capable of communicating with others your hopes, your desires, and your fears. You have friends, you have family, and you have a life.
And then suddenly, just like that, you need health care. Maybe you've had a medical emergency. Maybe you've been hospitalized. Maybe you need an operation. But if you haven't had much health care before, suddenly you're in a strange new world, a world with its own language, its own rituals, and its own culture. And you may not even have a smartphone app to help you through it, or a reliable visitor's guide.
So what happens to that independence, that self-sufficiency, that life? Or even that basic ability to communicate your needs or your fears with your healthcare team? And how does the healthcare system respect your individual dignity and self-worth, treating you as a whole person and not just your medical diagnosis? Well, we in the military's National Capital Region Medical Directorate care for nearly 250,000 beneficiaries tied by our common connection to military service. And within that connection comes a shared understanding and a military culture, and of our commitment to providing great care to our military beneficiaries in support of the nation's defense. And our military system comes with an inherent order, hierarchy, and discipline, all based on one's designated rank. And you combine this with a medical hierarchy, and we realized we had two very strong social forces impacting our patients' ability to interact with and engage in our system. And it's a very large health system. Worldwide, the military health system cares for over 9 million beneficiaries. From austere military operational environments to quaternary care centers, we aim to provide safe, reliable, high-quality care, respective of our patients. And we like to feel we've helped our patients along the way.
We'd also like to think that we're a high-velocity learning organization that can readily adapt to a rapidly changing environment. And in many ways we are. For example, with combat trauma care in our overseas efforts in Afghanistan and Iraq. At the beginning of that conflict, in the aftermath of 9/11, the survival rate for casualties sustained in the combat zone was around 84%. By 2013, it had risen to 94% through improved care at the point of injury, far forward trauma surgical teams, and a globally integrated network of critical care transport teams. Once back in the US, our restorative teams take over for rehabilitation. They're multidisciplinary teams providing holistic care, looking at the physical, mental, and spiritual needs of the wounded warriors, and also taking care of their families. But trauma is just one line of effort for the military health system. At our stateside hospitals and clinics, as well as our permanent bases overseas in Europe and Asia, we offer a full range of comprehensive health care across the spectrum of medicine, just like many of you do, most of you do in your healthcare systems. And just like you do, we do it through an integrated network of primary care medical homes, linked in with community hospitals, surgical centers, academic health systems and centers, and increasingly through telehealth. Looking at the National Capital Region, where Dr. Liu and I are from, it seems our patient likes the way we provide health care and how we provide it, at least according to our satisfaction scores, which consistently rank among the highest in the military health system, and they compare favorably with civilian benchmarks also.
But as a Chief Quality Officer of the National Capital Region Medical Directorate, I wondered if we were truly meeting the needs of our patients. Were we even measuring the right things? Or were those regulatory measures enough? And were those measures indicative of how satisfied, safe, engaged, and well cared for our patients were? Were we actually measuring what counted and counting what actually mattered? Well, many of these questions could not be answered with standard, traditional medical research, with patients as our study subjects or through satisfaction surveys. So in 2014, we launched a human-centered design project in the NCR, and we tried to assess our patients' needs, perceptions, attitudes, and preferences towards the care they received. And we wanted to learn about the factors that impacted their engagement and activation in our busy musculoskeletal service. And when we framed it as a design question, we asked ourselves, how might we better create a holistic healthcare experience for our musculoskeletal patients? And one that remained patient-centered, safe, reliable, and achieved great outcomes. Well, during the initial immersion and observation phase, we generated thousands of insights and data points and created hundreds of themes in the process.
One theme that emerged was that our patients often felt lost in our system. They felt like they had been dropped into a large, uncharted maze and asked to find their way through that maze all alone. Now, some were lucky enough to stumble upon an underground network of more seasoned patients who took the newbies under their wing and helped shepherd them through our system. In 2014, the unofficial leader of this underground network was a patient we'll call Sergeant Smith. Now, Sergeant Smith was a senior non-commissioned officer and himself a wounded warrior, and he had been on the Walter Reed campus for many, many months, going through a series of operations and a lengthy, complicated rehab. Like most of our NCOs, he was a doer and a fixer by nature, and we learned that patients and their families naturally gravitated to Sergeant Smith to help them navigate through their own healthcare journeys. Well, of course, eventually Sergeant Smith got better, and he left Walter Reed. And who was there to take his place in helping others find their way through the system? And how might we simplify our system and make our processes more patient-centered? And how might we make ourselves less dependent on the volunteer spirit of the Sergeant Smiths of the world? And what was a depressing finding this really was to learn this, especially in the face of those high patient satisfaction scores that I mentioned.
So we really wanted to help our patients better engage and navigate our healthcare system, ultimately by having Sergeant Smith, virtually of course, at every visit, in the form of a simple discussion guide. Now this guide was co-designed by patients for patients to help them quickly structure their conversations with their care team. It was modeled after the National Patient Safety Foundation's Ask Me 3 campaign, and it provided a quick series of prompts to help our patients better interact with their care team. And we learned that during our initial rollout of this guide in 2015 and 2016, that we could quickly teach our patients how to speak the language of healthcare and increase engagement and activation scores across all demographics in the process. This also softened the rank and professional disparity perceived and experienced by many of our patients and helped them better articulate their needs and engage with the care team.
Now, this shouldn't have come as a surprise to us, and it's probably not a surprise to many of you. As we all know too well from lessons learned the hard way, communication errors account for nearly 80% of sentinel events and other adverse outcomes in healthcare. And just as many of you has probably done, we turn to increased training for teamwork and for communication skills for everyone in our healthcare team. And we also took cues from highly reliable industries such as aviation and nuclear power, where they know well that effective communications are key for driving down variation and increasing quality and safety. In fact, the nationally recognized Team Steps communication program is a collaborative effort, or was a collaborative effort, between the Agency for Healthcare Research and Quality and the Department of Defense. In addition, we've made additional investments and improvements to our communicating processes during handoffs and transitions and other high-risk areas during the healthcare experience. For example, we've adopted and fully embraced the IPASS turnover curriculum. And in fact, one of our hospitals, Walter Reed National Military Medical Center, received the Eisenberg Award for Patient Safety, along with other centers that participated in the same collaborative study. We firmly believe that the best way to keep our patients safe is to fully engage them and get them invested in their healthcare processes. Now, with our early successes in orthopedics that Dr. Liu mentioned too, we wondered if we could achieve similar improvements in communication with a similar discussion guide for different clinical services across the military health system. To find out, we turned to our Patient and Family Advisory Councils, or PFACs for short, and asked for their input.
Those expert patient and family advisors have always worked closely with hospital and clinic leaders throughout our healthcare system to improve care delivery and that experience of care. In the past, they actually help engineer the rapid response team and how families could best initiate rapid response calls within one of our hospitals. They've also worked with our hospital and clinic leaders to best utilize social media in order to talk to the greater community of our beneficiaries. Well, those PFACs were integral in helping us mature and improve our discussion guide as we rolled it out to other areas in our healthcare system, most recently women's health. And did you know that women remain a significant proportion of the military health system's patient population, both as active duty members, retirees, and spouses to those active duty and retirees? They represent 15% of the active duty forces today, and that number continues to increase each year. And given the relative youth of our active duty population, with an average age under 35, quite a lot of babies are delivered within our military health system each year. About 50,000 last year, 4,000 of which were delivered in the National Capital Region alone. So going back to our study of the National Capital Region women's health clinics, we discovered that a higher baseline activation score existed in our women's health patients, even higher than female orthopedic patients in our earlier studies. But their engagement scores still continue to rise with the use of this guide, particularly for our first-time mothers and our junior enlisted members. It seemed like whether one came from a baseline level of low or high activation, this simple discussion guide helped our patients maximize their time with their care team. And the care team got to benefit from this in streamlining their clinic operations as well, because their patients already showed up knowing how to speak the language of healthcare. We continue to seek ways to partner with our patients in order to improve the healthcare they receive and experience. Starting this fall, we look forward to welcoming them as integral members of our long-range strategic planning team. A lot remains to be done, however, in bringing truly the voice of the patient, as well as their vision and strategic planning to the board level. So please stay tuned.
Well, as the director or chief executive officer of the National Capital Region, I knew we couldn't just focus on improving the patient experience at care. We had to better understand and improve the experience for our staff as well. We needed to better engage our staff in order to give them the strength and resilience they need to put it all in for their patients every day, all the time. So let's shift gears for just a minute and imagine that you're now a provider in our military health system. Despite years of education and training, despite being a commissioned officer in the military service, and despite these high-velocity learning successes that I mentioned about combat care in the combat zone, you start to feel totally fatigued, totally demoralized at your home base, and you realize that you're in a bureaucracy that sometimes can seem to stifle your creativity and imaginativity. You're worried, and we're becoming worried, that you might be burned out. How can we best help others within our system? A system,
that is perfectly designed to get the results it gets, as Paul Vidalin once said. And one within our system in which we've embraced this quadruple aim of better health care at greatest value, all within service of military readiness, remain at its core patient-centered. And one in which those same dual hierarchies affecting our patients of organizational rank and professional rank are at play with our staff, impacting their ability to engage and speak up. And how do we best leverage our greatest human assets within a system, and do so by supporting them to remain activated and engaged within our system, as well as remain within our system? Because it's been estimated that it costs about $1 million to bring in a new physician into any new healthcare system.
That's a lot of money. Well, we were happy that our patients seemed satisfied with us based on the patient satisfaction scores and HCAHPS. it appeared that we may have had the high scores at the expense of our staff, at least based on safety culture survey results and command climate surveys, which we do regularly, which showed that greater than 1/3 of our staff reported being physically, mentally, and emotionally fatigued or exhausted. Indeed, it looked like we could be dealing with staff burnout. Now, we know nationally that staff burnout is a big deal in healthcare. It's rampant, estimated at well over 50% of the healthcare team. And sadly, for us, increasing suicide rates among our military physicians, as well as the military service members in general, have been increasing, and they're now significantly higher than the U.S. population at large. These data serve to remind leaders at all levels that improving the experience of care needs to be improving the experience of caring for patients needs to be every bit as important as improving the experience of care for our patients. Well, we've worked hard across the DoD with intensive suicide awareness and prevention programs, but we searched in the NCR for a more holistic and effective approach at this.
And the crux of this improvement rests heavily on improving the culture, changing it from one that is punitive and blameworthy to one that is just and transparent in service of learning on behalf of safety, and one where we leverage the best intentions of everybody in the healthcare system and of our baseline commitment to doing no harm, and from which we can improve care.
We look to our organizational leaders at all levels throughout our organization as the stewards of our culture. To help these leaders improve our culture and performance, we started with the Military Health System Leadership Engagement Toolkit. In it, we leverage evidence-based practices for safety that help leaders to understand and reinforce key behaviors for high reliability. And we also incorporated lessons learned from working with the Center for Medicare and Medicaid Studies in their Partnership for Patient campaign. For example, rather than calling staff to the C-suite carpet when mistakes and errors occurred, we're emphasizing the importance of leaders getting out to the wards and to the clinics in the form of engagement rounds. We want all leaders at all levels to model a culture of safety and excellence by establishing a psychological safe place, or a place where there's a non-punitive environment, or where we encourage transparency and discussions about quality and safety, just as Amy Edmondson called for during her keynote speech on Friday. Personally, in more than 40 years as leading at various levels, I've observed that experience and culture affect everyone every day. Accordingly, we realized we needed more emphasis on chief experience officers and our CXOs to help with our culture-changing efforts. We expect our CXOs to be experience officers for both the patients and for the staff, helping to create that psychological safe place for both. Now, recognizing that our staff can only deliver the best care when they feel well cared for, the CXOs work closely with our teams to help improve our culture, improve staff engagement, retention, and activation. And in doing so, we believe that we are re-engineering joy, gratitude, and resiliency back into the workplaces to help prevent this burnout in our teammates.
And we do this ultimately by relying on those team members as experts in the context that they find themselves in. And in recognizing and deferring to that expertise, we're hoping to quicken the time from initial frontline good ideas to large-scale, system-wide improvement and innovation. And we've nurtured those frontline ideas last year in the form of our first innovation series. We started with 46 ideas proposed by staff, patient, and family members, and crowdsourced and crowd-selected the 5 most promising ideas that were most promising to support the 5-year business plan initiatives of improving quality, safety, and the experience of care for all of our patients. Our 5 final innovation projects included proposals to improve transparency and communications throughout a variety of care areas across our healthcare system.
And I'm pleased to tell you we're about to launch our second cycle of innovation. And this year we're going to encourage even more participation from our junior staff members to get them better involved and share and implement their bright ideas. And I'm especially excited that this cycle we're bent on including patients throughout the entire process, from bedside to boardroom. And we're going to ask them to help us co-design and co-create better ways for doing what we do for them and with them in order to improve the experience, the reliability, and safety of the care we provide.
And through this process, we hope to turn both the military and medical hierarchies upside down and include everyone, patients, caregivers, and staff members alike in this process to make things better for everyone, in the true spirit of everyone included. Thank you, everyone, for including us today.
Thank you very much.